First of all, I just want to thank the organizers. Thank the President Dr. Azubike who reached me and talked about a team like this towards primary mental health care. The focus is on how to bring internet care to the grassroots. Your insights will be valuable. Probably because of the arrangements, maybe this lecture will have come even before something that gives a good message so that they will, I'm going to skip areas I feel people have talked of. I will just skip and, but I have three major things we expect us to look at. The current entire primary care, the concept, identify the challenges we have had over years, and then the way forward. That's the essence. Because like somebody said, one of the speakers, I think our mommy, she observed that we have had policies over years, but implementation is the issue. At least 10 people quoted this. But why bother about mental health in Nigeria? Mental health of Nigerians, why are we bothered? People have talked about that. The burden of psychiatric disorders is high worldwide. The lady from Abuja the Prime Secretary reminded us of 1 in every 4. So, it is high. And we mentioned about substance use, especially the methamphetamine epidemic, kind of, as a primary. So, our people from America should be bothered because so many things that happen in Nigeria currently are enough to affect the mental health of Nigerians. Kidnapping, terrorism, and all that. I'm sure many of them, when they are coming back from America, they will ask, how is home? Traveling from any part to Enugu, you must ask. So all these are enough. But the truth is that despite these their numbers, only about 10% of Nigerians receive mental health care. And only few, less than that, receive quality. Why only 10 or less? Well, the DG of WHO, WHO told us mental health is not a luxury, but a necessity. It's not a choice, but a right. It's not a matter of charity, but of justice. That was the theme, based on the theme of mental health, World Mental Health Day last year. So, the summary there is that everyone should have right of good mental health. So, what do we have on ground? That's our first objective. What do we have? What do we really have? 9 standalone psychiatric hospitals, mental health units in many federal and state university hospitals and federal medical centers. Few states standalone psychiatric hospitals. In the whole of Southeast, I think it's only Anambra that is still functioning. The one who has a number in Abia has faced extinction many years ago. Few state secondary centers with psychiatric utilities. We are not sure what happens in the primary health center facilities. There's probably nothing. This is one of our standalone psychiatric hospitals, federal secondary. But what is important here is they are all located in big cities. They see people who visit them. If you say mental health services in primary center, what do you really mean? We're talking about mental health information and sanctification, early detection and treatment of minor mental illnesses, appropriate referral, and rehabilitation of those living with mental illness, and the community level. What is the rationale of integrating mental health and benefits primary health care facility is primarily for universal accessibility. The primary care workers are the front line, they're the first people that those who are ill come in contact. So there's increased access and accessibility. So the rationale, many reasons, it will reduce associated social stigma and human rights abuse. Mobility, hypertension, and others can be detected at the same time. Stigmatization that follow, when you're going to stand alone, to will be reduced. So these are issues. The thing personally that is on adopted. Go into there where other people are treated, specifically, it will reduce that stigma. The support is better when the family members are there. Cultural benefits, tolerance. If somebody has mental illness in his village and is treated there, he says that, he's taken out to a distant place. Because when he comes back, everybody watching. How is he doing? Is cheaper and all that. Is not the first. But what we are doing here today is special. It's not the first time people have made a call about integrating mental health into primary health. And I'll just be brief. Studies done many years back. But the summary of all the studies, the digital and moral kingdom, 21 years ago, Omibodu looked at two local governments in Oyo, 23 years ago, Odinga again, 22 years ago, Adeola and his team in Lagos. That was 2018. So, all that they found was that primary mental health services in primary care facility is absolutely not there or very minimal. They also found that if you train them, primary health care workers there, to handle basic things, that there is improvement. Briefly, let's just take a look. Different parts of the country. In the northern part of the country, some people have, looked at 3 states: Kaduna in northwest, Gombe in northeast, Benue in north central, and they interviewed 47 primary health care centers. Found out that in all of them, there is no mental health services. Let's go to southwest. The arrow, what they do there? From 2009, the Secretary of Abeokuta started a program. And what they have there is nurses posted to primary health care facilities with a doctor and psychiatrist visiting. Eventually, they got about 80 of them and trained them. And periodically, they will be supervised. But they face some challenges, and they said we should learn. If we want to do anyone, if we want to start out, we should learn from those challenges. One of them is there must be a political and goodwill from all the governments, both state, federal, and local governments. Sometimes some barriers come from government, and we must negotiate very well to avoid barriers. Professionals' commitments, very important. And that will call for incentives. Because if somebody is a nurse, and a nurse is a nurse, you train the same place, I'm working federal, receiving 10,000, we expect her to work in the primary health care center receiving 2,000. It will not work. So we must take that into consideration because they explain the handling of the states. So, there must be a condition to address it immediately. Unfortunately, people are living in droves these days. Health workers, I wonder how that can be handled in the country. We need to train and train. And there must be effective monitoring and evaluation. What on the south side? One group said there's nothing there. People have to travel to long distances. They are going to Selu, they are going to Sakatu Calabar, they are going to the hospitals before you can assess that. Out of our own southeast, well, I published a paper, I think some time ago. We were talking about universal health coverage. And that paper was titled Universal Health Coverage in Southeast Nigeria. How far with mental health? We were few, and everybody is in a tertiary hospital. Nobody is even in secondary. That is serious matter. So, we must take note of that. Then, second hospital, Enugu has a good mental health program, started some years ago, was meant to be a core state. Currently, is being rehabilitated. The University of Nigeria Enugu runs a community-based psychiatric service at their Okopa outstation. So, in Ebonyi, we have a desk officer. The Federal Minister of Health has said every state should have a desk officer in the state Minister of Health. Not all of them. We're already tying up a program where we want to start a mixed model of enhancement, training in health workers, and engage the people going from short to supervise. So, I know our women brothers and the vice chancellor said it must be here. So I want to appeal that everyone is ready for this program, for the support. Abia, the Abuja Integrated Community Mental Health Foundation, the reverend in charge of that place, the one who prayed alongside this program, by the aspect, they are doing a very good program there. The only that they go to the road and pick, homeless, vagrant psychotics, rehabilitate, and send back. Even when you have transport money, it's not easy to travel from Anambra to come, because you may prefer to live with your mental illness to come in and be kidnapped, and people be asking for ransom. So WHO should come in so that we establish the permanent care facility properly in all these local governments. Advocacy, awareness, and public education, very important. Very, very important. The person represented by Munachi said he's surprised that journalists are not here. We should do more than that. Advocacy. Digital therapy, yes, where we can also do counseling online and all that. NGO involvement, very important. We should get NGOs to be interested, and with the reviewed mental health policy, no encumbrances are expected. Because they are right, because sometimes NGOs may be interested, but government policies and others will deter them. Religious organizations, they are big stakeholders, and it's good that we get them involved. We should operate also at state and local government level, not just federal. Research, very important. Very important. Anything we're doing, research. Partnership. Yeah. There was a group that partnered with in Benue State, and they had a very good result. So I strongly commend the idea of the Nigeria American Institute of Mental Health to partner with various stakeholders in Nigeria to ensure a sustained integration. We can go on and on and on the way forward. We talk more during the panel discussion. In conclusion, ladies and gentlemen, we have made an attempt to remind us that there is no health without mental health. Secondly, integration of mental health into primary health care is the only way to go if we will achieve universal health coverage and the sustainable development goals. All hands should be on deck to overcome known barriers. The event of today is a very valuable one that we can't thank the organizers enough, and we pray their good intentions will materialize and more organizations will follow suit. Thank you so much.
Thank you.